Thank you very much for introducing me, and thank you for attending. What I'm going to talk about is, let me just start the slide. Something is, why it's not working? The first slide. Oh, is it there? Okay. It is, it's not working maybe. Not working. Okay, it's not like this. Okay, sorry. I will use this one. What I'm going to talking about something like different from medical stuff. Basically, almost everybody knows their medical work and things like that. But what we see challenging in our practice is when we want to lead our clinics or when we want to lead our departments. The problem is most of the other careers like lawyers, engineers, the engineer himself is the leader in his office or in his profession. Same thing for lawyers and the same thing in schools. But when it comes to healthcare, there are so many people who are leading the healthcare system, but many of them are not even physicians. And the physician role is becoming more and more reduced in healthcare leadership. So that is why I thought I want to bring up this subject just for general discussion, and this is part of my experience since I established in the past like departments of pediatrics in 2 or 3 facilities, and it was very challenging. So basically, I want to start with a problem. The problem is you are working in an older facility. It's like a 10-year-old pediatric facility, and it is staffed by pediatricians and nurses. This practice used to be very successful and has an excellent reputation. However, now it is lagging behind in the market because there are a lot of changes, and this department or this pediatric facility was unable to keep up with these changes, and patients start to transfer out and reduce productivity. It is a nice facility. Physicians and nurses are very qualified, but the practice is not doing very well. So the first question, this was the problem. So what is the bigger problem? So the bigger problem is when you are assigned to take over the leadership of this clinic or this facility, and your responsibility is to fix it. So how do you feel about it? Sad, happy, or some sort of in between? Because first of all, you don't know if you have the confidence to run such a clinic or where to start from. Now, this is not only it, it's also there is the biggest problem. What is the biggest problem? Any idea?
Propaganda and medicine.
Okay. Business, yeah. A lot of problems. The biggest problem is, as physicians, we are not trained to lead. This is the bottom line. We are trained to take care of patients. But when it comes to leadership, does this have a pointer? Is there a pointer? Does not work? Okay. So the biggest problem is that we as physicians are not trained to lead. So for me, this is the biggest problem, and then we try to figure it out. So this is why I thought to bring up this issue and see how we can start with any facility that needs to be fixed. And I use this strategies almost in everything I did, like either a project or establishing a department or fixing a problem, and I think it will be helpful. So let me just go to the next time. So what is the first thing to happen when you are assigned this responsibility? What is the first thing to happen? Check the resources. Well, let me tell you, it's the first thing to happen is basically you get congratulations. And you have your friends, your families, and also you think, is there any any kind of financial income or extra income for doing this type of job? So this is the first thing to happen. So everybody congratulates you and tell you, we will support all these things, you will get the first thing. So what is the next thing to happen? What is it? Well, it depends, but let's do it this way. The whole issue is not about getting paid for it. Is the whole issue about talking about this is to take over the healthcare system. This is the whole goal of this kind of presentation. The next thing is that you have to realize the honeymoon is gone and you need to start working. This is the next step. So what do you do next? Now you can tell me, what do you do next? Assess exactly. How do you assess? So how do you start with? Alone? Then you have to meet. Okay, so you run your first meeting. The first meeting is the first thing you do, and who you want to involve in your meeting? Who you want to include? Yeah, you need to include the staff, nursing, managers, supportive staff. So basically, exactly what you have said. And what you need to get out of this meeting. What is it about? To plan, okay. Basically, we need to open discussions, to brainstorming. You need to hear what people are saying, and also to identify your supporters and your resistors. Because there will be a change, and in any facility, there will be people who support the change, and there will be people who resist the change, and that's not bad, that's good actually. So after you sat with your team or your colleagues and you got just some ideas, then there will be the next step that somebody mentioned about planning. So we don't just plan from the first day. We have to get a little bit of feedback. And also if you have some sort of data collected, because I know in many facilities, they just collect data about waiting time, patient satisfaction, outside referrals, all these numbers will be helpful for you to identify the problem and to see where you are going. So your next step is another meeting. What kind of meeting would that be? Any idea? It is planning. It is the strategic planning meeting. This is the very important. This is the one that will make you draw the roadmap for what you are doing. So how do you do strategic planning? Any idea? How do you start? How do you facilitate it? Any idea? Excuse me? Okay, that's very good. What else? Yes, like teams and responsibilities. What else? Education of the staff. Excellent. Target, yes, exactly. What else? The problems and the solutions, yeah. So the way that I think it's a good idea to do it this way is this is the strategic meeting that you are going to do. And who are you going to include in your strategic meeting? Yeah, if you have divisions. So you have to find the stakeholders. You have to find the stakeholders, and it should be from all entities, including like people who are in management or in business or in marketing, plus of course nursing, and don't forget your resistors. That's very important. You have to include them in your meetings because they will help you a lot. It is normal to have resistors because normally humans resist the change. Plus, these resistors can open your eyes on things that you might not even think of. And sometimes they might be right. So it's very important to know their point of view, and they will help you they will put challenges for you. So this will help you to know about these challenges and try to overcome them with your planning. So the next step is basically how do you do the strategic planning? This is what we need to do, is exactly what you have said, but it has to be organized in a way that you make your meeting as fruitful as possible. So first of all, you need to find out where we are. And the next step, you find out where we want to be. And the third step is how to get there. So before we find out where we are and where we want to be, so what does where we want to be, what does that mean? Vision, exactly. So this is the vision. The first thing is to have a vision for your department. Vision and the mission. And then the other part is where we are right now is to do the full analysis. And there are several ways of doing this analysis. It is just some sort of root cause analysis to find out why we are doing this, why we are doing there. And one of these analyses is the SWOT analysis. Are you familiar with the SWOT analysis? The strengths, weaknesses, opportunities, and threats. I'm sure most of you use this type of tool to find out how we are doing and where we want to go. So the first step is to do a vision. If you don't have a vision, it's very difficult for people to know where we are going. The vision makes people like inspire. The vision can be inspired by people and make them like more focused and know where we are going. And the vision usually is not like where I want to be, like I want to be the best practice in town. This is not the vision. The vision is what are you going to offer, what people are going to get out of you, what your customer is going to get out of you. So I put this few statements about the vision that we can be used. One of them is about like transforming pediatric care to meet children and family needs. So this means a lot. So you look at what the needs are and you try to meet it, and what the family's needs are and you try to meet it. So it's a lot of things that you can do just based on this vision. Other vision like let no one be limited by disease. This is good for people who have like chronic illnesses, and the chronic illness does not limit the individual person who is affected by the disease, but also the other family members who are taking care of this child. Like for example, if a child has some sort of oncology disease or cancer, the whole family will be affected. If a child has a chronic infection or, a chronic infection or some sort of immune deficiency, the whole family will be affected because everybody will have to make some changes in his life to accommodate this child's need. Another vision is like better, easier, faster care. So people will start looking of how to make our care for these patients better and faster and easier, not to delay them, provide like better care. So there are several times, like another one is like every child deserves a pediatrician. This is if you are serving in a low-income area or underserved area and people don't get accessibility to a pediatrician, so this might be a vision as well. And then you decide on your mission, and these are the things that you can tackle to reach to or to achieve your vision. And in many scenarios in medicine or in pediatrics, we look at our patient care, we look at education, and we look at research. And I know the research is too premature for any facility that is struggling to use it, to implement it, but in the future it can be something. But care is very important, and education is something that will support the care that you are giving to the patients. So when we looked at the care, usually I like to use this statement about providing the care that is continuous, comprehensive, accessible, family-centered, culturally effective, and compassionate. Each one of these terms has a big meaning, actually. For example, when you say accessibility, you are not talking about the geographical location. You are also talking how easy for a patient to call and make appointment, how easy to be seen same day, how easy to speak to a physician, how easy to reach the physician after hours or the facility. So that's what accessibility means. How many insurance companies you accept, because if the patient insurance is not accept, this will affect accessibility. Patients with special needs, if they have like a wheelchair or something, can they access your physical location? So all these things like terms are used for accessibility. Other things like when we talk about culturally effective, it's just knowing other people's culture and try to serve them in a way that is acceptable for them. Like language barrier is something that we can talk about. And it is not only just giving a prescription, just understand that patient believes in the treatment and implement the treatment. Because if you just make the diagnosis, give the prescription, this is not going to be effective treatment for the family if they don't believe in this sort of treatment. And of course here in Dubai, why we have so many nationalities. So it is a lot of things to do with each of these. But if we take each of these and work on it, then or make it like our axis that we look at each time we make a change or we make a project, it will be very helpful. The next one is, so basically we decided our vision, we decided our mission, and now we are gonna go through our root cause analysis. And that's when you, as a team or during strategic planning, you do. So you look at strengths and you look at weaknesses. Strengths and weaknesses are something inside your facility, it's internal. And the opportunities are threats are something outside your facility, and these are like external. So I just put examples, but I'm not just saying this is what happens in every practice, but these are some of the examples for strengths and weaknesses that I faced before. For example, for some strengths, that this place has good history, good reputation, they have high ethics and professionalism, they have highly qualified physicians and nurses, the building is nice, the geographical location is also good. So they have a lot of strength that need to keep. At the same time, we look at the weaknesses. This is very important because these weaknesses will help you to decide what you are going to do, what is your next step. So you decide, first of all, lack of vision and mission. This is basically a big problem in many facilities, that people don't know what's the vision of the administration or the higher leadership and the mission and the vision of the department itself. They have to be aligned. So it is very important for the organization to have the vision so the departments and divisions can use the same vision or something that can align with it. For example, if you have suboptimal accessibility, could be due to insurance, could be your call center is not picking up all the phone calls, or maybe you don't have after hours clinics. So this can be looked at. So slow and insufficient response to changes. Continuously, the rules are being changed for healthcare. And if you don't keep up and see what is going on around you in the community or regulations, it will be very difficult to control. Looking at, for example, nursing shortage, this is our weaknesses that inside your facility. And underutilized space, for example, or underutilized resources. For example, you have a lactation consultant who stays in the women's ward, but when you have a patient in the clinic who needs help, they don't have access to her. So maybe you can use this one. So a lot of things that can be identified as weaknesses. Same thing, you look at the external opportunities and you see what are the demands in the community. For example, there is like medical tourism. So a lot of people coming from outside the country to get like treated. For example, I'm talking about here in Dubai. Multidisciplinary disease clinics are very well needed. Subspecialties. At one point, there were very, very, very few subspecialties in pediatrics. Home health nursing. Sometimes it is like very helpful and convenient for families. Telemedicine, although it did not fly here in Dubai, but sometimes you can just be more creative with it and make like some sort of after-hour telehealth medicine that is helpful to the family. Mental health, many facilities are lacking mental health for pediatrics. So many opportunities that we can work on to promote the services that we are giving in our clinics. And then the last thing is the threats that not much we can do about it, but we have to be very aware of it. A lot of it is because we are working in a very saturated market, and there is always increasing power of insurance, and they kind of control our practice. This is the reality. So we have to find a way how to go around it and make our program or clinic successful. So after we do all of that, we put a plan with the team. And the plan, we put phases. For example, for pediatrics, if you don't have a very strong general pediatric base, it's very difficult to build other programs. Because at the end of the day, the pediatrician will, even if you are taking care about tertiary care patients, like oncology patients, they still need their primary care physician to take care of all other things and the rest of the family as well. So it's very important to have a strong general pediatric base. And this, you have to look at outpatient clinic, inpatient services, emergency emergency services. Maybe you can be a little bit more creative and create a travel clinic. So you go by the needs. It doesn't have to be all done at the same day, but at least you focus on the things that can make the general pediatrics more unique in their services compared to other places, just to bring up the level of care in that place. You can look at telemedicine. You can look at adding new services. You can look at patient educational programs like workshop on feedings or making anticipatory guidance or immunization refusal education. Then you go to phase 2 when you add subspecialties, and you can decide which subspecialties are priority to you, and add like a mental health program, early intervention, PICU. So all depends on your situation, if you are in outpatient clinic or inpatient. And then you look at level 3 when you become more tertiary care facility and add more of the subspecialties, plus starting to have condition disease target program. Now each one of this list, it can be an endless list actually, and you don't have to do it all together at the same time, and you don't have to go by order. You can overlap phase 1 and phase 2 or phase 2 and phase 3, but it is a roadmap for you to continue, and each of these items by itself is a huge project. So the whole thing about developing the program and preventing it from failing again is to have continuous efforts to improve and develop the facility. So what I choose the outpatient clinic because this is like the basics for any pediatric services. And the first thing we will do, like you choose one and you work on it. And then you choose a second one and you work on it. So maybe you can choose 2 or 3 things and work together on them, like outpatient clinic and improve the inpatient services and improve the urgent care clinic as to start, for example. So the next step will be is to create an action plan. This is very important for you to follow up on the services and on the it is very important to have the action plan for the follow-up. So you start looking at each item separately. So you look at the space, you look at the staffing, you look at the management, you look at the equipment and resources. And then you decide which are the items that you have control on and easy to change. And you tick them because these are easy to manage. For example, if you look at the management area, like the space, you have inappropriate waiting area. Is there anything I can do about it? Can I add like maybe some decorations, maybe put some toys for the kids, something like that. Second, the physician-nurse schedule, it's not well coordinated. So can we coordinate that to make sure that physician-nurse can work together as one team? For example, inconsistent workflow. This is easy to fix if you look into it and see where are your bottleneck and try to fix like registration area, to fix like triage area, to fix the time where the patient is waiting for physician, just to facilitate the work. So you look at the things that you have more control on. And then you identify the items that you have less control on, but you still have some influence. Like, for example, insurance. These areas might not be under your direct leadership. It might be under different person leadership. So that's why it becomes a little bit more difficult to make the change through them. But that doesn't mean that you don't tackle these areas as well. For example, insurance, electronic records. If you don't have the authority to make changes, create templates, it will be a little bit more difficult. So it depends on your situation. You can decide which ones are more possible to tackle or not. And then you find the most difficult areas, mainly with hiring, because it's not something, you don't own the place. So it's not something in your hand to do this hiring. So basically, after you do that, you come up with a project on what you are going to do, and you look at the outcome of the project, and you look at how easy the project is going to be. So, and basically, if the project is too difficult with low impact, you remove it from your mind. If the project is easy with high impact, this is the one you have to focus on. And then there are projects that are kind of high impact but difficult. You still consider them. It depends on how much time and efforts you have and resources. And the project with low impact, you also might do them, but they are not your priority. So the biggest focus is on your high impact and easy to do projects. And then you make up this outpatient clinic action plan with describe whatever you are going to do in each item, who is the responsible person, the follow-up, and the deadline.
One minute, doctor.
Yeah,
please.
1 minute. Always think about your care principle outlined in the mission. So anything you do, it should be around this principles. And the opportunities, I just put one example. During lockdown, because the accessibility was very difficult for patients, so we created home visits. But the second thing we did in the facility where I used to work at was the drive-through services, and it was very popular. And the reason we did this service is because patients requested it. We were getting phone calls asking patients, can you see us in the car? And then we found it's a good idea, so we made this project. And it did not cost us much money. We used our facility garage, and we just put a desk, and it was already air conditioned, and we just do some kind of coordination between patients and our service, and it worked very good. So this is one example about using opportunities. And just to remember always this kind of strategic planning for building departments or for improving departments, it goes side by side, quality and productivity to reach your milestone and go toward your vision. And thank you. Any question? Last? Okay.